Hi! Good day everyone. I am Cervical from BSN1E of Holy Trinity University, and today, me and my partner, Jason Heidi P. Gonzalez, will begin our micro-teaching on cervical mucus method. And with further ado, let's begin. Cervical mucus method. What is cervical mucus method? The cervical mucus method is a type of a natural family planning. It is also called and labeled as the Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. And before ovulation, cervical secretion changes, creating an environment that helps the sperm to travel through the cervix, uterus, and fallopian tubes to the eggs. By recognizing these changes in your cervical mucus, you can try to pinpoint when you are likely to ovulate and when you are most likely to conceive a baby. So, if you are hoping to get pregnant, you can use the cervical mucus method to determine the best days to have unprotected sex. And if you want to avoid pregnancy, the cervical mucus method can help you figure out which days to avoid unprotected sex. And using the cervical mucus method for birth control requires motivation and diligence. If you don't want to conceive, you and your partner must avoid having sex or use a barrier method of contraception during your fertile days each month. So, why it is done? The cervical mucus method is done for natural family flying, as I've stated earlier. It is done to help identify the female's fertile time. And lastly, to help the couple determine the best days to have or avoid unprotected sexual intercourse. So, the cervical mucus method is a way to identify the fertile times to help you gauge the best days to have or avoid unprotected sex. And tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reasons. This method is sometimes combined with another fertility awareness method, such as tracking basal body temperature. You might also use an electronic fertility monitor to measure the hormone levels in your urine, which can tell you which days you are fertile. This combination of approaches is sometimes referred to as the symptom-thermal or symptom-hormonal method. So what are the risks of using the cervical mucus method? Using the cervical mucus method to promote fertility doesn't pose any risk. And likewise, using the cervical mucus method for birth control doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections like HIV and STDs. In addition to that, the risk of an unintended pregnancy with cervical mucus method is somewhat higher than with other methods of birth control. And it is estimated that as many as 23 out of 100 women practicing the cervical mucus method for birth control will get pregnant in the first year of typical use. And with perfect use, the pregnancy rate may be as low as 3 out of 100 of women a year. Formal training is usually needed to master the cervical mucus method. You'll also need to make sure to check your cervical secretion every day and keep track of changes. And in addition to that, abstinence or use of another type of contraception is typically needed for 14 to 17 days each cycle.
So, hello everyone, my name is Gonzalez Justin Heidi and I am the partner of Mr. Sari Jaridi Dumalio, and I will continue his micro-teaching about a cervical mucus method. So, first is how you prepare if you want to use a cervical mucus method. So, it's important to understand how cervical secretion change during a typical menstrual cycle. So, generally, you will have a no noticeable cervical secretions for 3 to 4 days after your period ends. So, next is scanty, cloudy, and sticky secretions for the next 3 to 5 days. So, next is abundant, clear, and wet secretions for the next 3 to 4 days, the period before and during ovulation. So, next is no noticeable secretions for 11 to 14 days until your next period begins. So, although the specific length of this phases may vary. Contact your healthcare provider if your cervical symptoms don't follow this general pattern. You may have an infection that requires medical attention. So next is how you prepare if you want to use a cervical mucus method. So if you want to use the cervical mucus method, birth control, consult your healthcare provider first if you recently had your first period, gave birth, or stopped taking birth control pills or other hormonal contraceptives. Next is if you are breastfeeding, if you are approaching menopause, and last, if you have a condition that disrupts regular ovulation such as polycystic ovary syndrome. So, your healthcare provider may discourage the use of cervical mucus method if you have persistent reproductive tract infection. So, next is what you can expect if you use a cervical mucus method. So, you can use the cervical mucus method no matter how many days long your menstrual cycles are. To use this method, first you need to record your cervical secretions for several days. So, starting the day your menstrual bleeding stops, observe and record your cervical secretions on a daily chart, either on paper or with an app designed to track fertility signs. To avoid confusing cervical secretions with semen or normal sexual lubrication, avoid sex or use a barrier method of contraception during your first cycle. So also avoid douching, which can wash out cervical secretions and make it difficult to notice changes. Next is, or second, you need to check your cervical secretions before and after urinating. So, wipe front to back with toilet tissue. Record the yellow, white, clear, or cloudy consistency, thick, sticky, or stretchy, and feel dry, wet, or slippery of your secretions. Also, note sensations of dryness, moistness, wetness in your vulva. And lastly, you need to plan sexual intercourse carefully during fertile days. So, you are most fertile when your cervical secretions are abundant, clear, stretchy, wet, and slippery. Smash like a raw egg white. If you're hoping to get pregnant, this is the time to have sex. Ovulation most likely occurs during 1 day after your last day of this type of cervical secretion, known as your peak day. If you're hoping to avoid pregnancy, unprotected sex is off limits from the day your cervical secretions begin until 4 days after your peak day. So, if you have sex before your cervical secretions again, you may want to avoid sex the next day and night so that you don't confuse semen and arousal fluids with cervical secretions. Interpreting and charting secretions can be challenging. Most women need more than one instructional session to recognize the pattern of secretions in typical menstrual cycle. Talk with your healthcare provider if you have questions or concerns. So, a simpler version of cervical mucus method is an approach called the 2-day method. With the 2-day method, you note whether you have seen cervical secretions that are clear, stretchy, slippery, a sign of peak fertility, either today or yesterday. If the answer is yes, then consider yourself, filter, abstain, or use a barrier method of control to avoid unattended pregnancy. When detecting ovulation from cervical mucus, if you feel dry or sticky, you are not ovulating. And when you feel wet and watery, your ovulation is very close. And when you feel creamy, ovulation may be coming. And when you feel very wet, stretchy, resembles or raw, or you feel a raw egg white, your ovulation is, you are in ovulation.